Good morning or good evening, depending upon whether you're watching or listening or both here. This is Medica Pharmacy's For Your Health on WBRT Radio and BRTV, and Allison Schwartz joins us again today. And last time, if you were tuned in, you kind of gave a preview, I think, of what we would talk about.
I did.
And you didn't fail. And HCG and diets. And there's a whole bunch of things going on in the world of dieting, and it's all in the most cases for the betterment of our health.
For most of the time, yeah. The HCG has been around, and of course, Dr. Oz talked about it, and so then we just got inundated with phone calls and questions about, can we get HCG? Do you guys do HCG? Is it safe? How does it work? You name it. So, yes, we can supply you with HCG. It is a prescription product, but you can get it from Medica Pharmacy. So I thought, well, let's talk a little bit about it since he brought it up and people are asking questions. But before we delve into it, I thought, well, let's start out talking about the other things out there that are more commonly used for dieting and weight loss. And the most common thing that we see used in the pharmacy is a drug called phentermine, which is the generic for Adipex. It's been around for a long time. It used to be combined with an old weight loss drug called fenfluramine, and it killed a lot of people in that combination.
Mm-hmm.
So the fenfluramine was taken off the market. They decided that was the evil culprit part, and they took that away. It is a stimulant drug. It's, equivalent to speed. And so you have to think, well, if it's similar to speed and it's a stimulant, then it's going to have those type of effects when you use it. So you can get high blood pressure, you can get heart palpitations, a faster heart rate, dizziness, headache, dry mouth, because it tends to rev your system up. You don't sleep as well. Of course, many times I've talked about the key to losing weight is you've got to get a good night's sleep. The interesting thing about phentermine is that you develop a tolerance to it within the first couple of weeks. So your maximum benefit is usually at 3 weeks. You're also not supposed to use it for more than 3 months in a row. And the vast majority of people with it gain their weight back. Not all of them do. There have been some people that have had success with it. But you have to be monitored regularly for your blood pressure and your heart rate to make sure that it's not adversely affecting that part of your body. Anytime you give yourself a stimulant, you affect your adrenal glands, which kind of makes your body go. Mm-hmm. And once you do that, you can have some issues. So it's definitely a drug you need to be cautious with.
Is it what they call a controlled substance?
It is a controlled substance, so you're limited on how often you can get it and how long your prescriptions are good for. So it is. It's more controlled. Not, as badly as some of them, but it still is a controlled substance. Lately, there's a new drug that is getting ready to come out. Now, it's a drug that's in combination with phentermine. So we're actually taking a new combination and going to try another round. And what's interesting about this drug is it actually went up for approval in 2010, and it got turned down because it was not shown to be safe enough to be on the market. So strangely enough, they've re-entered it in, and now all of a sudden it's safe. The drugs haven't changed, so we're a little confused on how it got approved the second time around. But it got approved. And it's combined with generic Topamax or topiramate. Now, Topamax is a seizure medication. Its side effect is that it can cause you to have weight loss. It showed over time of people using it for seizures that they lost weight. And so they decided maybe it would be a good weight loss drug. Most of us are not real sure about that. We don't really like it. I don't feel that most healthy people should be taking a seizure medication because when you come off of a seizure medication, you actually can have a seizure. So why would you want to be seizure-free and take a medicine and then try to lose weight and maybe you come off of it and you lose, have a seizure? So I'm not sure that I'm a big fan of it. Actually, I know I'm not a big fan of it. We'll see what happens as it actually gets out on the market and people use it. There's been a huge amount of drugs in the past that the FDA has said is safe. And then years go down the road and lots of bad things happen and then, it's not very safe. We're going to pull it off the market. So I'd like to think hopefully that won't happen with this one. But, we'll see as time goes. So the main side effects with this one is headache, but, that can be the phentermine or the Topamax. But Topamax has been shown to cause a glaucoma-like syndrome. So you have to kind of pay attention to your vision. Is it blurry? Do I have pain in my eyes? So that's a potential side effect.
Now, are you talking about, is it just a symptom you're getting, or are you actually getting some detrimental things happening to your eyes?
This could be detrimental. I mean, it can cause glaucoma. And so if you actually have any form of glaucoma, you absolutely cannot take this drug. It also can cause dry mouth, constipation, and it can cause anxiety and depression. So it does those as well. And it actually can increase your body temperature. which maybe is how it helps you lose weight, because, your body temperature goes
You say
burn more fat, but I don't think you want your body temperature up for very long periods of time. We're designed to be at 98.6, so I don't think we're supposed to go without it. The other thing it can cause is a metabolic acidosis, so it increases the acidity of your body. Now, I don't want to scare anybody, but when you die, the reason your body decomposes is because it turns to acid. So your body being in an acidic environment is not good. The only thing that's really supposed to be acidic is your stomach to digest your food. Everything else is supposed to be, either evenly pHed or your saliva should be alkaline. So, or more basic, I guess I should say. So that can, is concerning. So we'll see where this drug goes, how it works, and what it does. They said that it had, in studies, that you would lose about 10% of your weight loss in a year's time. So if you're a 300-pound person, that's going to mean that maybe in a year you're going to lose 30 pounds. Now, we'll equivalent to how much weight you lose with HCG as soon as we get there. Okay. The last drug that's been out for a while is Orlistat was the prescription, and the over-the-counter one is called Ally. So basically, this drug keeps you from absorbing fat. So it's not really systemically absorbed, so it doesn't have a lot of increased blood pressure type side effects. What it does have is you can get a headache, and you can get anxiety. Now, if it keeps you from absorbing fats, the most important thing you have to have in your brain for all your chemicals to work right to keep you from being anxious and depressed are your fatty acids. Well, if you're not able to absorb fats, then I could see where maybe that's why you would have some anxiety or depression. But it has some really unwanted side effects like leaky stools, and you have major urges to go to the bathroom, and sometimes you have spotting in your underwear because you can't absorb fats, and so they tend to leak out of your anus. And so, not a lot of people want to take those, because who wants to walk around all day thinking maybe I might have an accident? But it's real. If you can't, and you have to think about it, if you can't break down fat, it goes through your body really quickly. And sometimes you are running to the bathroom with this type of drug. So, that not a lot of people really want to try it. Yeah. Not that dangerous of a drug, except that it does make you deficient in all your fat-soluble vitamins, so you have to make sure you supplement with that. And even if you do supplement, sometimes you still have deficiency. So not the safest, not the most unsafe, but most people don't want to try it. It's fairly expensive, and, it has some embarrassing side effects more than dangerous side effects. Yeah. So.
Did you mention it being over the counter?
It is over the counter.
Over the counter, okay.
It is over the counter. So now we'll get on to HCG. Okay. So, like I said, Dr. Oz mentioned it, so I thought we'd talk about it. So, for those of you that don't know, HCG is the hormone that's produced by the placenta when a woman is pregnant. Okay?
Very healthy for the baby, is that right?
It is. It does have a purpose, and I'm actually going to mention that. And it actually is kind of how it works to make you lose weight. So, a lot of people wonder, well, if it's a hormone that you get in pregnant, then surely men can't take it. Surely it messes you up. But it really doesn't. It doesn't have any direct action on any endocrine system in your body. So it's not going to make, women get deeper voices. It's not going to make men grow breasts or lose their virility. It doesn't affect men in any adverse way that way.
Keep our hair from going gray and maybe get a little extra?
Maybe makes your hair grow back. I'll check on that for you. But, so the purpose of HCG is, you think about it, thousands of years ago when man first came around, we didn't have a McDonald's down the road. We didn't have a kitchen. We didn't have pots and pans. We didn't have a grocery store. So we're hunters and gatherers, and we didn't eat every day. If we did eat, it was snacking on plants and berries and nuts and seeds. And so the purpose of HCG is to mobilize your fat in your body, abnormal fat. So normal fat that's like around your organs to keep you healthy, protect your organs, it doesn't touch that. So the fat that shouldn't be there, it mobilizes that. And so that ensures that the baby has calories and has nutrition to survive even if you're not eating. Okay, so if you think about it that way, you think that it keeps that baby alive by burning our fat. Well, if there's no baby to feed, it's still going to burn fat. It still encourages fat. And so it was actually used first off when they discovered kind of how it worked with mobilizing fat. It was actually used in a disease called Froelic's disease, which is a pituitary disease, and it actually causes obesity because it causes the distribution of abnormal fat. So they found that if they use HCG in this disease, it will burn off that fat and help keep that person from being as overweight. So that's kind of how it works. And so the first question I always get is, well, I hear you have to eat like 500 calories a day if you're on HCG.
That's not a lot, right?
That's not very much. The average person eats, way too much. I'm going to say the average American probably eats anywhere from 3,000 on up calories. And most of us only need 2,000 or less to survive every day. So, 1,500 to 2,000 is normally plenty. So if you're thinking, well, I should eat 2,000 calories a day, how am I going to survive on 500?
Yeah, you should lose weight anyway.
You should. And so we actually tell people, you really don't have to maintain 500. You can do 800. You may not have as much weight loss, but when HCG starts to mobilize that fat, it actually, every pound of fat you mobilize provides you with over 2,000 calories a day.
Wow.
So you're only eating 500 calories, but your body is producing 2,000 calories just by burning its fat.
So you're getting some energy there.
So
I kept wondering how you would keep going with only 500.
Right. It's because you're burning off your fat. And any nutritionist will tell you that the most dense caloric foods are fat foods. So, protein and carbohydrates have 4 kilocalories per gram, and fat has 9. Okay, so you get a lot more bang for your buck when you eat fat. And that's what people tell you. You go out to eat and you eat something fatty like a fatty fish, tuna, sardines, mackerel, avocados, nuts. You don't eat as much and you stay full for a lot longer. So fat is actually very filling to the body. So that's why you don't have to eat as many calories. So you can buy HCG over the counter, people say. You can, but it's not really HCG. It is some diluted form of who knows what that has never been, none of them ever tested have ever had any measurable amount of HCG in them, but they're all on the shelf. HCG is not stable at room temperature. It has to be kept in the refrigerated. So you don't want to go buy HCG over the counter. It's not going to work for you most likely. You're going to have all these side effects that you read about, the I'm hungry, I'm dizzy, I'm all this stuff, because you're not feeding your body because there is nothing in it. So you want to make sure you're getting a quality product. So make sure it's from a compounding pharmacy. It doesn't have to be, us at Medica. There's other pharmacies in Louisville and other areas that compound it. I know plenty of pharmacists throughout the nation that have been compounding HCG for quite some time with great success. But just make sure that you know what you're getting. You don't want to go buy something made in China that's sugared water. That's pretty much what you're getting. The second question we always get is, well, with all these other programs, we tend to gain weight back. Am I going to gain my weight back when I stop the HCG? So, not as much. They say 60 to 70% of people that use HCG actually have very little difficulty keeping their weight off. So, it actually resets and increases your base metabolic rate. So, everybody will tell you as you're trying to lose weight that the more muscle mass you have, the more calories you burn. And as you burn fat, you increase your metabolism. Well, that's how it works. So as you burn that fat off, your metabolism rate goes up. Your appetite will actually change, because as you start to reset your metabolism, you'll notice that you don't have some of the cravings for the sugary stuff, the bad for you stuff, and you don't actually eat as much. So you'll start to learn that you can eat less. We are not designed to eat 3 meals a day. We never have been. We just adapted to that. Our bodies have not, which is why obesity is such an epidemic. We're designed to eat the nuts and the seeds and the berries. And once in a blue moon, we shoot a deer or with, a bow and arrow back in the day, and you don't cook it in a pot or cook it in a microwave. You cooked it on a fire. And you didn't save it for later because it went bad. And so you're not designed to eat the way we eat now. And so we have completely messed up our metabolisms by eating stuff we eat. So this actually helps you to more eat the way you're supposed to eat. So
you mentioned compounding it. What do you compound it with? And
it comes in a powder form.
Okay.
It is derived from humans. So they, actually get the HCG from the urine of pregnant women, and they purify it and, make it into a powder form. And then you can get it in a variety of dosage forms. Some pharmacies compound it into an injection. We don't do sterile compounding. A lot of people do it in creams, nose sprays, and sublingual drops. So most people prefer a sublingual drop. Super easy. Put a few drops into your tongue. You do it twice a day. And you're done with it. Nasal sprays, if you want that, that's fine. It's easy enough to make, and then the creams are easy to make as well. So those are the 3 that we make it in. But right now, the people that have started it are using the sublingual drops.
Okay.
So that's it. And then the last two questions is, one is, how much weight will I lose? So we talked about in 1 year you might lose 10%. So if you're 300 pounds, you'll lose 30 pounds. If you're 300 pounds and you use HCG, then on average you will lose 1 pound per day. So you will lose 30 pounds in 30 days. Okay? Now, after that, you cannot do a round of HCG for any longer than 40 days. Anywhere from 40 days at a time. So 23 to 40. So if you only have 15 pounds to lose, you're only going to need to do it for 23 days. And I will tell you that the more weight you have to lose, the more successful HCG is. Yes, it'll help you lose 15 pounds, But if you need to lose 100 pounds, you're actually probably going to be a heck of a lot more, what's the word I'm looking for? It's going to work better for you. Brain freeze there. So, but once you're done with that 40 days, say you do need to lose 150 pounds, you're clearly not going to lose that in 40 days, but you can't just go do another round of HCG. We then roll you into the maintenance phase for 6 weeks. And at the end of that maintenance phase, then you can do another round of HCG. We offer a class for this, so to get HCG, you actually have to go through this class. You have to follow up with us at the pharmacy for education, for us to measure you. To ultimately be successful, you have to have that coach behind you. Because it's with everything. All of these drugs that you lose 10% of your weight with, it says with diet and exercise. HCG, you can lose it without diet and exercise, but you're going to have to do that to maintain it in the end. Okay, so that's why we have you coming in, doing the classes, going through the educational process, and letting us follow up with you as the time goes to make sure that you're ultimately successful. And all of that's rolled into the price of the prescription, so there's no added consultation fees. You don't have to pay me every time you come in. You just pay for the prescription, and then we follow you. And then the last question is it safe? How can it be safe to lose 30 pounds in 30 days? So my first thing I always tell people is, how safe is it for you to be 200 pounds overweight or 100 pounds overweight? I mean, every organ of your body suffers, your joints suffer. You have every adverse disease out there is caused by obesity. Everything is linked to obesity and stress and no sleep. So it is safe. The most of the adverse reactions have been reported with the over-the-counter ones or the injectable form. And the biggest ones of those are dizziness, headache, and hair loss. And the hair loss that's seen with HCG actually comes back when you come off of it. So it's not permanent.
It'll come back dark.
Yes, it is temporary. Well, I don't know about that.
No promises.
You wear your color well, Roth. I think it's fine. You don't want to get darker. So those are the main points with it. But, it is available. It is a prescription. Some doctors, think maybe it's okay. And there's a lot of doctors that aren't sure about it. No, it's not FDA approved for weight loss. To be FDA approved, it has to be a product that can be made into a commercially available pill, liquid, some kind of prescription. You cannot make a natural hormone in the body commercially available. You can't patent that. So no drug company is going to run it through the test. It will never, ever be FDA approved. Just like vitamins and supplements will never, ever be FDA approved. You can't do that. So if your concern is it's not FDA approved, so I can't take it, then it's not for you. But I can tell you that we have seen plenty of people do it. I've seen people that have lost up to 200 pounds. They still have that weight down 3 to 5 years later. They're doing great. So I myself, with the people I know have done it, have not seen anything that concerns me that I would not say, if you want to try it for 30 days and you're willing and your doctor's willing, then give it a try. The worst thing that's going to happen is you're not going to lose a pound a day. You might lose a half a pound a day. But most people lose a considerable amount of weight on it.
And as you mentioned, it is a prescription, so the doctor has to write the prescription as it is involved, and you guys are also involved with the entire program. And I think besides the great part of that being somebody's feeling of safety is the fact that sometimes you need coaching along in weight loss. A lot of the successful weight loss things are because people are being coached along or being helped along because it's a motivation every once in a while.
It is. All of us have so much going on in our lives, everything, that it always helps to have someone that's, there, being your cheerleader and being your coach. And we like it to really work with the doctors. I mean, we feel like for ultimate patient care, the doctors, the nurses, the pharmacists, the patients, we all need to be on the same page and we need to work together. So you go through this program, yes, your doctor has to give you the prescription, but then every bit of information that we do with you, every measurement that we take, everything that we tell you, coach you, give you, your doctor is going to be aware of that. We send all of that to them. So when you come in for a check-in to weigh or measure, we're going to send those results to your doctor. So they're going to be every step of the way there with us. You also get a welcome kit. So when you first sign up, you're going to get a food scale and you're going to get a water bottle and you're going to get a really good multivitamin, a good omega supplement, and some B12. So you're going to get a nice welcome kit to kind of support you to make sure your body has the nutrition it needs to go through this program. And we'll tell you all about it. So don't hesitate to give us a call and ask some questions. But you do, make sure you talk to your doctor. And we have some resources on our website. There's Dr. Simeon actually wrote a really big, extensive book on the HCG diet, how it works and how to do it. So we always recommend that's part of our class is that you need to go through that book. and talk to your doctor about it and take that information to your doctor, see if they're on board. Obviously, the doctors are always welcome to call us, and we've talked to a few of them about the program. But there's a lot of information out there. There's a lot of commitment you have to do. You can't just come in and get a prescription. I mean, not only do you have to take the course, but you have a patient accountability. So we want to make sure you're successful. So you have to agree to do what it takes to do the program.
And Allison, people that listen to this show know that you've stressed so many times about how obesity is the number one reason for illness and death among our population in Kentucky and across this United States, and tragically also affecting a lot of our children too. And, so it's a real thing out there that weight loss can make you live longer and have a better, more productive life too.
It is. I think it's the saddest thing out there that they say obesity is the reason that this generation of children is going to die before their parents. And, I know a few people who have had children die, their children die before them, and I've always been told that that's the worst thing you can ever experience. So, it's kind of scary and very sad that we're facing that a lot of us out there that are alive today are going to outlive our children because of this obesity. And so anything that we can do to get it under control and reset how the body works, because, like I mentioned, we're not designed to eat 3 meals a day and snack all day, and we're not. And so if this is going to help us reset that metabolism and help us change the way we eat for the better, then I'm all for it.
And they need to get a hold of you or anybody at Medica Pharmacy here. And do you also do this up at your county?
Pretty much anything we compound. We can do it out of Shepherdsville, but we send the product to them. Okay. We make it here in Bardstown. So the Shepherdsville store is not as up about it. They'll refer them to us. So the one girl that has done the most research on it, her name is Trisha. So they can either ask for myself or they can ask for Trisha. We're the ones that have most of the information, and Trisha's the one that's been working with the patients so far. And then Garrett, he's helped us get together with some marketing stuff, and so he knows a little bit about it as well. But mostly you want to ask for me with Trisha.
That's at Medica Pharmacy. And again, you can see them here in Bardstown at 4th and Flagey, and of course, Stephen Foster.
I was getting ready to correct you on that
one. And you can check it out online, and your website is?
It's medicapharmacy.net, and then we're Facebook, Twitter, LinkedIn, Foursquare. We're on all of those. But the information for the HCG and all that information is on our website at medicapharmacy.net.
Allison, thank you very much.
Thank you. Have a great day.
You bet. That's our show today. It is For Your Health from Medica Pharmacy. I'm Bob Stratton. This is Allison Schwartz. Thank you for joining us.